Trying to conceive. 5 tips for women. The most important advice for a woman who wants to get pregnant is to get to know her body, specifically her menstrual cycle, said Dr. Mary Ellen Pavone, a reproductive endocrinologist and infertility specialist, and medical director of the IVF program at Northwestern Medicine's Fertility and Reproductive Medicine in Chicago. Here are 12 tips that may help increase a healthy woman's chances of becoming pregnant, assuming that neither she nor her partner have a known fertility problem. Record menstrual cycle frequency. A woman who wants to have a baby should monitor whether the first days of her period tends to come the same number of days apart every month, which is considered being regular. Conversely, her periods may be irregular, meaning her cycle lengths vary from month to month. By tracking this information on a calendar, a woman can better predict when she might be ovulating, the time when her ovaries will release an egg every month. A woman's egg is fertile for only 12 to 24 hours after its release, according to the March of Dimes. However, a man's sperm can survive in a woman's body for about 6 days, notes Planned Parenthood. Monitor ovulation. Women with regular cycles generally ovulate 2 weeks before the arrival of their periods, Pavone said. It's harder to predict ovulation in women with irregular cycles, but it usually occurs 12 to 16 days before the start of the woman's next period. There are several methods women can use to help determine their most fertile days each month. Home ovulation prediction kits can take some of the guesswork out of finding when a woman is ovulating. They're good to use for this purpose, Pavone said, but she suggested reading the instructions before using the products, since each kit can be a little different. Sold at drugstores, the kits test urine for luteinizing hormone, a substance whose levels increase each month during ovulation and cause the ovaries to release an egg. The 3 days right after a positive test result are the best time for couples to have sex to increase their odds of becoming pregnant, reports the American Pregnancy Association. Other clues to ovulation include the basal body temperature method, in which a woman takes her temperature before she gets out of bed every day and charts this on a graph for at least 3 menstrual cycles. After a woman ovulates, her basal body temperature typically increases less than half a degree Fahrenheit, 0.3 degrees Celsius. A woman is most fertile during the 2 to 3 days before this slight rise in body temperature, reports the Mayo Clinic. A second method is tracking cervical mucus, which involves a woman regularly checking both the amount and appearance of mucus in her vagina. A study published in the journal Fertility and Sterility found that women who checked their cervical mucus consistently were 2.3 times more likely to get pregnant over a 6-month period. Just before ovulation, when a woman is most fertile, the amount of mucus increases and it also becomes thinner, clearer and more slippery, said the March of Dimes. When cervical mucus becomes more slippery, it can help sperm make its way to the egg. Have sex every other day during the fertile window. The fertile window spans a 6-day interval, the 5 days prior to ovulation and the day of it, according to the American Society for Reproductive Medicine. These are the days each month when a woman is most fertile. One study found that intercourse is most likely to result in a pregnancy when it occurs 2 days before ovulation. Research has shown that there hasn't been a big difference in pregnancy rates between couples who had sex every day during the fertile window, 37%, compared with couples who had sex every other day, 33%, Pavone said. And having sex every other day might be easier for a couple to pull off, she added. There are plenty of common misconceptions and old wives' tales about conception. For example, there's no evidence that the position a couple has sex in will influence their chances of having a baby, nor does a woman lying on her back for a certain amount of time after intercourse increase the odds of conceiving, Pavone told Live Science. Strive for a healthy body weight. Being too heavy can reduce a woman's odds of conceiving, but being too thin can make it even harder to have a baby. Research has shown that a woman who is overweight, her body mass index, or BMI, is greater than 35, can take twice as long to become pregnant as a woman whose BMI is considered normal, Pavone said. A woman who is underweight, her BMI is less than 19, might take 4 times as long to conceive, she said. Having too much body fat produces excess estrogen, which can interfere with ovulation. Losing 5 to 10% of body weight before a woman starts trying to get pregnant could improve her fertility, according to the American Society for Reproductive Medicine. Women who are too thin might not be getting regular periods or could stop ovulating. Take a prenatal vitamin. Pavone recommends that women who are attempting to conceive start taking a prenatal vitamin even before becoming pregnant. This way, a woman can find one that's more agreeable to her system and stay on it during pregnancy, Pavone said. Another possibility is taking a daily multivitamin, as long as it contains at least 400 micrograms, mg, per day of folic acid, a B vitamin that's important for preventing birth defects in a baby's brain and spine, Pavone said. The Centers for Disease Control and Prevention urges women to take 400 mg of folic acid every day for at least 1 month before getting pregnant to help prevent birth defects. Getting a head start on folic acid supplementation is a good idea because the neural tube develops into the brain and spine 3 to 4 weeks after conception occurs, before many women realize they're pregnant.